why, as the title says, I think we should see strengths and brilliance, not limits, in children with autism as well as their autism family. And last week, of course, I talked about the fact that when you see a parent who likely has a child on the spectrum, please assume that they likely already know a lot of things as it relates to different medications or therapies. They've probably tried those things. And of course, if you're going to share some information with the parent, do so in a sense of humility. So we already talked about that. Today, we're talking about the fact that most of our children on the autism spectrum, like many children, have natural strengths and natural brilliance. There's something about our kids that I think they shine just a little bit brighter, and I'll share the story of why I think that may be the case. But I would like for you, your call to action for today is to let me know of one way that you've seen someone who is neurodiverse, neurosparkly, has autism, or some other type of neurodiversity, where you've seen that they just kind of shine a little bit brighter, whether it's after they've had a compliment or you've seen them excel in a certain area. Whatever way you've seen that, I would love for you to show up and do that. And I'll talk about a treatment that we've used here in the office, at our Let Life office. I'm actually in the TMS office today. TMS, transcranial magnetic stimulation. There is an autism protocol, and we've actually used that autism protocol. And we've seen things with TMS and also Spravato, which is used for depression. We've seen that with folks who are neurodiverse, things that they've mentioned about the treatment that I would not normally see that in a person that's neurotypical. So I'll save that to the end. But again, Dr. Virginia, double board certified psychiatrist, is also a lifestyle medicine provider. So, presume competence, what is that? You're making the presumption or the assumption, but just premeditated assumption, right? You're making an assumption that the person that you're talking to likely already has competence on some level. When people who know my child has autism, like for example at church, when they come to him, they don't automatically assume that he's deaf or blind. They don't automatically assume that he cannot speak and or that he can't communicate in some way. They come to him and they'll say things like, "Hi, how are you today?" They're presuming that he has some base level of competence in that he can see them, he can hear them, he understands receptive language. On some level, he understands what they are saying. And I love that. I enjoy that. I think that is something that I know that I do as a professional, but also as a parent of children that are neurodiverse. I appreciate that. And I do believe that many other people within the community of special needs appreciates that as well. I know when I've met patients who have a different ability from a movement perspective, maybe they need to be in a wheelchair sometimes or need to use a walker. If I automatically just move things out of their way, presuming or assuming that they can't maneuver it, they'll pause me and say, "Hey, I kind of got in here maneuvering that on my own. I don't need you to help me. Get back out." I'm like, "You are right. I apologize for that. I just assumed that you needed my help to navigate. They didn't need my help. They were able to do it just fine." Okay. And then which has now led me to ask a person if I see they're in a wheelchair, or they're coming behind me and they're moving a little slower. And maybe I've pressed the wheelchair assist for myself and my son. But again, I see someone coming behind me. I will now make sure that I say, "Can I get that for you? You want me to leave the door open for you?" And sometimes they'll say, "No, go on. I'm moving slower," or "I'm taking a pause or a break." I honor that, right? I'm presuming that they are competent enough to know whether or not they need my help. And if they don't need my help, then I back off and allow them that space to be able to do whatever it is that they need to do on their own without me just kind of, you know, assuming that they can't do it. So again, in autism specifically, there's a concept of presumed competence, but it does generalize to other conditions. So when you're doing something like ABA therapy, there's the presumption of competence for certain things. Not everything, but for certain things. So I think that's cool. As it relates to strengths and brilliance, every parent, I am very safe to say this, that every parent that I have ever met, every parent that I know, and more than likely every parent who has a child with autism will tell you that they have a special kind of strength. We code name it autism strength. That autism strength. I've been to conferences, I've been to people's homes, I've talked to them on the street, in the grocery store, in the pharmacy. And we all get it when we're like, yeah, they have a different kind of strength. They're like, yes, there's a different kind of strength they have. Have a child who's a little bit dysregulated and they're having a difficult time kind of calming themselves down, and you need to physically intervene. I am telling you, I work out for multiple reasons, but one of them is so that I can assist my son if he has difficulties. And I could tell you stories. I will save this story for another time because it involves someone else and I want to make sure I have their permission to share it. Everybody's story is sacred and I want them to share their own stories. But I can tell you from myself, one time I needed to place my son on a hold because he was banging his head and I didn't want him to hurt himself. So I had to place him in a hold. And there was another person there, his aide, who was helping at the time. And I had to tell the aide what to do. So while I'm explaining to the aide what to do, the aide is just kind of standing there looking. And I'm like, I need you to grab his feet because literally I had my son in a chair hold on the floor, which is interesting. In front of me, I'm holding on, right? And then I've got my legs crossed across him. It took all of my strength to hold this child. And at the time, he was smaller, lighter, and younger than he is right now. It's a different level of strength when our little people get upset about certain things or get dysregulated. Not so much tantrums, but they're on sensory overload and they just cannot figure out a way to calm themselves down. There's a different kind of strength. So our kids are very strong, but there's also a strength in them that is not the physical strength that I'm talking about. Just a strength to be able to do things that the average person just takes for granted. You and I, we hear things, we mimic, there's reciprocity, and we can learn a language just by listening and attending. Whereas a child on the spectrum or another child with a different ability, child with dyslexia, for example, they have to learn and encode, and it is harder for them to learn to speak. It's harder for them to learn to read, to learn to write. Things that we just kind of take for granted that we're going to pick up as children in school, it can be quite daunting for them. So there's a strength and a resilience about these kids and adults that just kind of boggles my mind at times. So don't think about that. And from a family perspective as well, usually that family is navigating so many things. It's difficult to tell a child. I'm just going to throw out a couple examples. It's difficult to tell a child, a young child, about concepts like life and death, heaven, not heaven, what earth is, living on the earth, our country versus another country, friends, people that are not necessarily have your best heart. Those are all abstract concepts that the average child doesn't get until they're about 8 years old. I want you to imagine trying to explain some of those concepts to someone who is not neurotypical, who learns differently. Even if we're talking about something neurodiverse like ADHD, they're on a different operating system. You're on Apple and they're on Android, or vice versa. So you do need to be patient. And I'm really big on, again, I talked about this last time, 5-second rule. Okay, if you don't pick up anything from this entire month of listening to me, 5-second rule, please. 5-second rule just means that if you are talking with someone who is neurodiverse that has a different ability, please give them that additional time to understand what you're saying. And I'm going to take a little bit of I'm going to give an example, and then I'm going to talk specifically to my first responders. An example is if I say, Amir, pick up the pieces of paper on the floor. I'm giving him 5 quick seconds. Not 1 Mississippi, 2 Mississippi, 3 Mississippi. That's too long for him. But for him, and if you don't know the child or you don't know the adult, give them a little bit of time. And then I'm going to repeat it. This is something I learned at Kennedy Krieger. Love the work that they do. But repeat it, but then show Amir like me, and I'll reach down and I may pick up one piece of paper. Okay. So notice something that I didn't say. For me to be able to tell this child and then do it so that they can do it like me, I have to be close. I have to be close enough that I can probably reach out and touch this child for them to be able to pick up on that. Right. Again, we're not assuming crisis or urgency. I'll get to that in a moment. And then I'm likely to be somewhere on his level. Maybe a difference of sitting and standing, but I'm close enough and somewhere in his face that he can see and hear all of the things. He can see my mannerism, he can see the actions that I'm using, he can see my mouth. Some of our kids do read lips. They don't like making eye contact. I know my son, for example, it's very difficult for him to make eye contact. It's difficult for me to make eye contact. And so a lot of times kids or adults on the spectrum are looking at your mouth. They're quasi reading lips. They can hear what you're saying, but they're looking at your lips and your overall facial expression just to get an idea of what should I be doing right now. If you look at them and I look at my son and I'm like, which I don't look at him like that, but like, yeah, I kind of give them that look like, I want you to do something, you're not doing it. He recognizes that. Whereas if I'm like, good job, Amir, you did a really good job. I'm proud of you. He notices the difference in that. And he can tell by that whether or not he's on the track to doing something well, or he's on the track that he probably shouldn't be on, cross tracks, because you're headed the wrong direction. Okay. The last thing I would do as a 3-step would be hand over hand, pick up the papers off the floor, Amir. First 2 times he does it, good job. I give verbal praise, I clap, I'm like, high five, good job, you did it. Third time, there's no good job. Okay, I'm not giving him that additional positive attention. Not giving negative attention, but not giving him the positive attention. Now let's transition over to crisis. Remember I talked about high P. High P is high probability that you say something and the child or the adult's going to do it. This child's dysregulated. They're going all over the place. I'm going to try to see if I can give them some space, maybe stepping back to give them some additional space. My tone, I do this with my patients a lot. If my patient is just amped up, upset, whatever, especially if they're upset about something and they're kind of taking it out on me, Regina's natural tendency is you get loud, I might get loud. Dr. Regina's professional tendency is you get loud, I get quiet. I get much quieter when a person is dysregulated in my office, or when my child is dysregulated, or when I'm talking to an adult, even in my personal life, and I can see that they're dysregulated. You may or may not be able to hear me right now because I'm specifically getting quieter, and I'm also lowering my voice. The pitch of my voice as well. For those musical inclined people, you might have picked up on the fact that I'm not talking like this anymore. I'm talking like this. I'm giving you more of my natural tone right now. Okay. This is my psychiatry voice. This is also my voice when I'm doing voiceovers. This is also my voice when I am doing certain professional things. Okay. I'm going to use this tone and this voice when I'm trying to calm someone who is very dysregulated. Because the higher and louder I go, the more dysregulating it can be. It's a funnier voice, it's kind of cooler voice sometimes, but it can be dysregulating for some people. The higher pitch can be dysregulating. So I'll go to a lower tone and a lower pitch, especially if a person's very dysregulated. Do you notice the difference? Again, the people that are the musicians or musically inclined people, you picked up on it right away. But for other people, I tried to demonstrate it. And also, this is more my serious voice. So when my kids are in trouble, that's the voice they get. But that's a different aside. But see how we can navigate things. So for my first responders and for my teachers, you guys already know a lot of this, but I'm repeating it again because there are some people that don't know. They haven't worked with people who on the autism spectrum, or they're having difficulties. If you are working with someone who is just completely dysregulated, maybe they're being aggressive or appearing like they might be self-injurious to themselves, or they might be injurious to another person and you're not quite sure, you don't know what they're going to do, one of the first things I'm going to do is I'm actually going to get further away, right? And I'll talk about this a little bit later for setting up a room for people that are professionals and setting up a room. You always want line of sight to your door and your exits, but also I want to be farther away because if the person is very agitated, they might do something in their agitation, has nothing to do with me. It could be taken as aggressive, but it has nothing to do with me. They're not aggressing at me. They're just acting out of their nervous system overload. So they might be all over the place. I've seen my son clear a room, literally, because he's so out of it. And then he doesn't seem to have any recollection afterwards. Okay. I'm backing up. I'm getting out of the way. All right. Now, for professionals that have to get in there to help, sometimes they are doing a hold where they're trying to get him against a soft space or against the corner of a room, if need be, if they're concerned that he's going to hurt himself. Otherwise, he can be in the room or in an area by himself where there's nothing in there, no table, no chairs, no books, no nothing. And he's just in there, just kind of doing what he does until he calms down. If that is the case, again, I'm backing up, I'm moving away, I'm lowering my voice, and I'm saying soothing things. For my son, I sing. For the rest of you, I don't. I'll just say something quiet. I might say, it seems like you're not okay right now, and that's okay to be not okay. It's okay to not be okay. For him, I actually sing the song, It's Okay to Not Be Okay, the Jen Johnson one. For him, I might sing Breathe In, Breathe Out, the Sid the Science Kid one. Okay. And it depends on who I'm talking to and what I'm dealing with at that time, right? If I'm trying to reach the more adult version of him, I might sing the Jen Johnson one. If I'm kind of trying to get to the inner child version of him, it's the Sid the Science Kid. Breathe in, breathe out. Or I might say, I want you to take some nice deep breaths. Breathe in, breathe out. Okay. I know you're frustrated right now. I know some things are difficult for you right now. So just take a nice deep breath in. Hold it. And out. Hold it. Okay. Having some difficulties right now. I get it. I might speak slower. You're okay. I'm okay. We're okay. If I know he hears me and he can attend and focus, he's going to repeat me. If he doesn't repeat me, I know he's out there. He's gone. He's in outer space and I got to bring him down. I got to bring the rocket down like Artemis 2. So without crashing and burning, right? So then I might say, okay, let's count. 1, 2, 3. I'm doing, again, high P. He knows how to breathe in and out. He knows how to count. I might say, and then I might give a mand. A mand is a demand, a command, a mandate. Those are mands. Amir, clap your hands. Amir, turn in a circle. He wants to turn in a circle anyway. Amir, turn in a circle. But now I know he hears me. Okay, Amir, what color is your shirt? Purple. Okay, that's very good. You are wearing a purple shirt. Clap your hands. Good job, Amir. You clapped your hands. Very good job. Okay. These are all things we do to help calm. You're a first responder. You come on the scene. You don't know what's going on. Presume competence. Presume that this person likely can hear you to some extent, but you don't know. And while you're trying to get information from your dispatch team, from your other team, again, I've already talked about this in another video. One voice, not 10, not 5. The person can't hear like 4 or 5 people talking at one time. Not yelling, firm tone. Again, if you yell and that seems to upset the person, come down a little bit. Either talk lower or talk in a deeper voice. Because the deeper you go, the likelier the person can hear you. Too high of a tone, too screechy of a tone might be too much. Try it out. Every person's a little different. I know in the crisis or urgency, it can be difficult, but this is why I always recommend that people do ride-alongs with a social worker or someone else that's trained. And many county departments have this. So I'm very much a big proponent of this. but you're going in as a team, and preferably the social worker or the person that is the trained mental health respondent first, with the backup of the legal person, the police, or whomever. But hopefully these tools that I just mentioned will be a help for you, because again, what we want is a way to calm down and regulate the person, or help them regulate themselves, as opposed to heightening and dysregulating. Okay. So those are just a couple tips. My hope is that's helpful for you. I'm looking at some of the comments. So great information as usual. Thank you. I appreciate that. I see my middle child go down um, to level for her to pick up the mess she created the other day, but not just telling her, but showing her. Yes, the 3 steps: 1, 2, 3. First telling, 5 seconds, then showing, like me, pick up the papers. Okay, I got some papers right here. These papers are on the floor. Like me, pick up the paper. Then I drop it back. Pick up the paper. Like me, because you just saw me do it. And then if they don't, then it's hand over hand. Let's pick up the papers together. Okay. The first 2 times, pick up the papers. Oh, good job. You picked the papers right up. You knew how to do that. Good job. Pick up the papers like me. Great job. You did it just like I did. Very good. Oh, you can't do it. Hand over hand. Pick up the papers. Then I don't add anything after that. All right. I started with you guys TikTok over here, so I'm going to end you guys first. It's been a pleasure. Thank you so much. You guys have a very blessed day on purpose. And for my folks that are here over on Instagram, YouTube, LinkedIn, Facebook, I think I got all of you guys. If you would be so kind to do the things that I mentioned before, the call to action that I gave initially the first time was as it relates to, if you've got someone on the spectrum or person that's neurodiverse, please take the time to kind of think about their special strength or the special way that they might be showing their brilliance. And if you don't, of course, you can always find one. You can always find a person who's neurodiverse just about anywhere and just tell them a string. I mean, push comes to shove, you can go to social media, type in autism, and see somebody that's going to pop up and tell you that they're on the spectrum. And then you can just basically say, hey, love this video. This was great. Thanks for sharing your world. I appreciate that. Right? Nothing wrong with that. Nothing wrong with giving people their flowers while they live. Okay? You guys have a very blessed day on purpose. Take care.